ഹലോ ഫ്രണ്ട്സ്, പുതിയൊരു വീഡിയോയിലേക്ക് എല്ലാവർക്കും സ്വാഗതം. 21/3/2023 നടന്ന കാറ്റഗറി നമ്പർ 274/2022 സ്പെഷ്യൽ റിക്രൂട്ട്മെൻറ്റ് സ്റ്റാഫ് നഴ്സ് എക്സാമിൻ്റെ ക്വസ്റ്റ്യൻസും ആൻസേഴ്സും ആണ് ഈ വീഡിയോയിലൂടെ ഡിസ്കസ് ചെയ്യുന്നത്. ഒരു ക്വിക്ക് വ്യൂ ആയിരിക്കും, കാരണം 75% ക്വസ്റ്റ്യൻസും നമ്മൾ മുന്നേ കണ്ടിട്ടുള്ളതും റിപ്പീറ്റഡ് ആയിട്ട് ചോദിച്ചിട്ടുള്ളതാണ്. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, ഡാഷ് ഈസ് എ പോളിപെപ്റ്റൈഡ് ഹോർമോൺ produced by parafollicular C cells of thyroid gland. The options are calcitonin, thyroxine, triiodothyroxine and parathormone. And the answer is calcitonin. The next question, dash is cranial nerve 5. The options are olfactory, optic, facial and trigeminal. And the answer is trigeminal. The next question, the amount of filtrate formed in all the nephrons of kidneys in 1 minute is termed as. The options are filtration fraction, glomerular filtration rate, glomerular capillary pressure and colloid osmotic pressure. And the answer is glomerular filtration rate, that is GFR. The next question, the largest and strongest bone of body is. The options are radius, femur, ulna and scapula. ഇതൊക്കെ ജസ്റ്റ് ഒന്ന് ഇയർഫോൺ ഇട്ട് കേട്ടാൽ മതി, എന്തെങ്കിലും കിച്ചൺ വർക്കിലോ അല്ലെങ്കിൽ ട്രാവലിങ്ങിലോ ആണെങ്കിൽ. ആൻസർ ഈസ് ഫിമർ. The next question, pepsinogen is secreted by. The options are chief cells, parietal cells, goblet cells and pancreas. The answer is chief cells. The next question, Bacillus of TB was discovered by. The options are Nielsen, Hansen, Robert Koch and Joseph Lister. And the answer is Robert Koch. The next question, normal flora which lies on or in our body with complete harmony without causing damage is called. The options are saprophytes, commensal, true pathogens and facultative pathogens. And the answer is commensal. The next question, spherical or oval shaped bacteria are classified as. The options are bacilli, spirilla, vibrio and cocci. And the answer is cocci. The next question, infectious disease transmitted from animal to human being is called. The options are opportunistic infection, vertical transmission, zoonosis and nosocomial infection. And the answer is zoonosis. Next question, modified acid-fast staining commonly used for staining Mycobacterium tuberculosis is. The options are Seal-Nielsen staining, Gram staining, negative staining and none of the above. And the answer is Seal-Nielsen staining. And the next question, the most primitive structure of human personality operating according to the pleasure principle is called. The options are ego, id, superego and conscious level. And the answer is id. The next question, intelligent quotient is. The options are mental age divided by chronological age into 100, retrieval, chronological age divided by mental age into 100 and none of the above. And the answer is mental age divided by chronological age into 100. The next question, the ego defense mechanism in which consciously discharging pent-up feelings to a less threatening object is. The options are repression, denial, displacement and conversion. And the answer is displacement. The next question, misinterpretation of actual perception is, the options are hallucination, illusion, limited attention and perceptual organization. And the answer is illusion. Next question, an automatic learned behavior pattern that enables an individual to handle specific type of environmental situations easily is termed as, the options are perception, attention, memory and habits. And the answer is habits. Next question, the process of learning that enables the learner to perform social roles and ability to participate in social system is, the options are socialization, group morale, social change and social security. And the answer is socialization. The next question, the type of family in which mother plays a dominant role in the family is, options are matrilocal, matriarchal, patrilocal and patriarchal family. And the answer is matriarchal family. Next question, the type of marriage in which one woman marries several men is, the options are monogamy marriage, polyandry marriage, group marriage and polygyny marriage. And the answer is polyandry marriage. The next question, the type of family which consists of blood relations together with their children is, the options are conjugal family, neolocal family, consanguineous family and avunculocal family. The answer is consanguineous family. The next question, a social group with we feeling and living in a given area is, the options are family, society, race and community. And the answer is community. The next question, the first step to be followed by a healthcare worker who sustained a needle stick injury is, the options are inform the supervisor immediately, squeeze the area and expel the blood, wash with soap and water, clean with povidone and cover the area. And the answer is wash with soap and water. Next question, the method of disposal of discarded medicines and cytotoxic drugs, that is outdated, contaminated and discarded drugs. The options are autoclaving after mutilation or shredding, secured landfill after mutilation or shredding, incineration without mutilation or shredding and microwaving without mutilation and shredding. And the answer is secured landfill after mutilation or shredding. Next question, while discussing about post-exposure prophylaxis for hepatitis B injection, the correct procedure of post-exposure prophylaxis for an unvaccinated healthcare worker and the source is unknown as, the options are complete the 3 doses of vaccination 0, 1, 3 doses, administer 2 doses of hepatitis B immunoglobulin 1 month apart and administer 1 doses of hepatitis B immunoglobulin and complete vaccination in 0, 1, 3 doses and administer 2 doses of hepatitis B immunoglobulin 1 month apart and complete vaccination in 0, 1, 3 doses. And the answer is administer 1 dose of hepatitis B immunoglobulin and complete vaccination in 0, 1, 3 doses. Next question, Weil-Felix reaction is used to diagnose disease caused by, the options are rickettsia, mycoplasma, chlamydia and clostridia. And the answer is rickettsia. The next question, best procedure for managing upper airway obstruction in infant is, the options are helmet manner, 5 back slaps and 5 chest thrust, back slaps continuously till the object expelled out and abdominal compression. And the answer is 5 back slaps and 5 chest thrusts. Next question. What should rescuer do after the automated external defibrillator shock while doing BLS or ACLS? The options are immediately check the carotid pulse, not more than 10 seconds, and immediately restart the CPR beginning with the chest compression. Wait for AED to analyze the rhythm. Provide 2 breaths to the victim. And the answer is immediately restart the CPR beginning with the chest compression. Next question. Which of the following finding would the nurse expect to assess in hypercalcaemia? The options are prolonged QRS complex, tetany, petechiae, and urinary calculi. And the answer is urinary calculi. In the next question, a client with end-stage renal disease is admitted in nephrology ward and his blood result shows serum potassium as 6.6 mEq/liter. What should the nurse assess first? The options are cardiac rhythm, blood pressure, respiration, and urinary output. And the answer is cardiac rhythm. The next question. In a health education session, a nurse explains reason for chronic cough except the options are angiotensin converting enzyme inhibitors, chronic smoking, beta blockers, and chronic bronchitis. And the answer is beta blockers. The next question. The best indicator for identifying the adequacy of fluid replacement therapy in acute phase of burns. The options are serum potassium level, serum sodium level, sunken eyes and skin turgor, and urinary output. And the answer is urinary output. The next question. Which of the following is not a primary prevention? The options are pulse polio immunization, vitamin A supplementation, breast self-examination for tumor, and INH to a baby breastfed by a sputum positive tubercular mother. And the answer is breast self-examination for tumor. The next question. Which is the best measure for evaluating standards of therapy? The options are specific death rate, case fatality rate, survival rate, and crude death rate. And the answer is survival rate. The next question. The first person becoming sick in an epidemic is called. The options are index case, primary case, secondary case, and none of the above. And the answer is primary case. The next question. Vaccine contraindicated in pregnancy is. The options are rubella, typhoid, diphtheria, and hepatitis B. And the answer is rubella. എല്ലാ ലൈവ് വാക്സിൻസും പ്രഗ്നൻസിയിൽ കോൺട്രാഇൻഡിക്കേറ്റഡ് ആണ്. ദ നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ. കോമണസ്റ്റ് ഏജൻറ്റ് കോസിംഗ് ഡയേറിയൽ ഡിസീസ് ഇൻ ഇൻഫാൻസ് ആൻഡ് ചിൽഡ്രൻ ഈസ്. ദ ഓപ്ഷൻസ് ആർ ഇക്കോളൈ, റോട്ടാ വൈറസ്, വിബ്രിയോ കോളറെ, ആൻഡ് സാൽമോണെല്ല. And the answer is rotavirus. The next question. All are true about the ideal contraceptive except the options are safe and inexpensive, irreversible, independent of coitus, does not require frequent administration. And the answer is irreversible. The next question. All of the following are food fortifications except the options are iodization of salt, adding of vitamin A and D to vanaspati ghee, addition of color to saccharine, and addition of iron to wheat flour. And the answer is addition of color to saccharine. The next question, which of the following vitamin function like a steroid hormone? The options are vitamin A, vitamin B1, vitamin C and vitamin D. And the answer is vitamin D. The next question, which of the following mineral element causing pathological changes in bones and teeth in its excess as well as deficiency? The options are chlorine, fluorine, zinc and copper. And the answer is fluorine. The next question, name the program introduced by Government of Kerala for differently abled persons for rehabilitation in 2017 is. The options are Kaitang, Ardram, Kaivalya and Adijeevanam. And the answer is Adijeevanam. That provide fund to establish people to start their own business. Next question, normal ET CO2 value of an incubated patient is. The options are 60 to 70 mm of Hg, 35 to 45 mm of Hg, 20 to 30 mm of Hg and 25 to 35 mm of Hg. And the answer is 35 to 45 mm of Hg. Next question, metabolic emergency frequently found in small cell lung cancer is. The options are syndrome of inappropriate ADH, hypercalcaemia, metabolic encephalopathy and tumor lysis syndrome. And the answer is syndrome of inappropriate ADH. The next question, immune reaction occurring in blood transfusion reaction is a type of. The options are microangiopathic reaction, autoimmune reaction, macroangiopathic reaction and isoimmune reaction. And the answer is isoimmune reaction. Next question, post myocardial infarction patient if complaint of chest pain increasing with deep breath, which nursing action is appropriate? The options are obtain vital signs and auscultate for pericardial friction rub, and obtain 12 lead ECG and inform physician immediately, give high flow oxygen, give SOS analgesics and observe for 30 minutes. And the answer is obtain vital signs and auscultate for pericardial friction rub. Next question, a patient after gastrectomy complained of sweating, weakness, palpitations and dizziness 15 to 30 minutes after eating. Which among the following is the best advice to give? The options are reduce fat and protein in diet, have 3 regular full meals, don't take fluid with meals but 30 to 45 minutes before or after meals, have a concentrated sweet dish after meals. And the answer is don't take fluid with meals but 30 to 45 minutes before and after meals. Next question, lowest possible dose of apoetin alpha is used to treat anemia in chronic kidney disease because the options are high dose is associated with the high rate of thromboembolic events, it is highly hypersensitive, minimum dose can stimulate erythropoietin production and it is costly, and last one is it is nephrotoxic in nature. The answer is high dose is associated with high rate of thromboembolic disease. Next question, accumulation of hydrophilic mucopolysaccharides in the dermis and other tissue is seen in. The options are scleroderma, SLE, elephantiasis and myxedema. And the answer is myxedema. Next question, ABG value of a patient shown pH 7.0, PaO2 90 mm of Hg, PaCO2 23 mm of Hg, HCO3 12 mEq/liter. What does it indicate? The options are compensated respiratory acidosis, uncompensated metabolic acidosis, partly compensated metabolic acidosis and partly compensated respiratory acidosis. And the answer is partly compensated metabolic acidosis. Next question, a patient complained of drowning sensation on the one side of face followed by paralysis of all ipsilateral muscles is admitted to your unit. Which among the following is most possible diagnosis? Options are tic douloureux, Bell's palsy, Meniere's disease, and glossopharyngeal neuralgia. And the answer is Bell's palsy. The next question, pterygium can be defined as, options are white deposit found on the cornea, fleshy triangular shaped growth on the conjunctiva, cyst found on the conjunctiva, and scarring of cornea. And the answer is fleshy triangular shaped growth on the conjunctiva. Next question, a mental health nurse adopts role play or socio-drama for facilitating insight into client's behavior. The most appropriate principle used is, the options are avoid unnecessary increase in the client's anxiety, use self-understanding as a therapeutic tool, change the patient's behavior through emotional experience, not by rational interpretation. Objective observation is used to understand client's behavior. And the answer is change the patient's behavior through emotional experience, not by rational interpretation. The next question, false fixed belief, which can be explained as arising from other abnormal experiences, is called, the options are unspecified delusion, primary delusion, autochthonous delusion, and secondary delusion. And the answer is secondary delusion. The next question, a nurse while being with a client with violent behavior should not, the options are provide high calorie foods, argue with the client, provide a consistent structured environment, give simple direct instructions. The answer is argue with the client. The next question, during the working phase of nurse-patient relationship, the mentally ill client breaks appointments, comes late to the therapy, and being forgetful. The nurse identifies that the behavior is an example of, the options are resistance, counter-transference, transference, and boundary violation. And the answer is resistance. The next question, a client receiving antipsychotic developed neuroleptic malignant syndrome. The dopamine agonist drug usually administered is, the options are dandrolene, bromocriptine, pacitine, and metoclopramide. And the answer is bromocriptine. The next question, a person persistently wears clothes of opposite sex or fantasy for sexual arousal. This disorder is, the options are dual role transvestism, primary transsexualism, secondary transsexualism, and fetishistic transvestism. And the answer is fetishistic transvestism. The next question, a client with schizophrenia present with negative symptoms. The nurse understands that one of the following is not a negative symptom. The options are attentional impairment, asociality, alogia, and ambivalence. And the answer is ambivalence. The next question, a child present with low per accuracy in the use of speech sounds. The speech sounds are omitted or substituted. This disorder is, options are dyslexia, dysorthographia, and dyslalia, and dyspraxia. And the answer is dyslalia. The next question, a non-alcoholic client admitted to de-addiction center has been started on disulfiram. The usual dose of disulfiram is, the options are 250 to 500 mg, 750 to 1000 mg, 50 to 100 mg, and 100 to 200 mg. And the answer is 250 to 500 mg. Next question, The nurse renders parallel skill training during antenatal and postnatal visit. The approach is, the options are secondary prevention, primary prevention, tertiary prevention, and primordial prevention. And the answer is primary prevention. The next question, the cardinal features of nephrotic syndrome are the following except. The options are edema, hypoalbuminemia, proteinuria, and hyponatremia. And the answer is hyponatremia. The next question, the birth weight of baby triples by. The options are 8 months, 9 months, 12 months, and 6 months. Birth weight of baby double ആവുന്നത് 5 monthലാണ്. And triples ആവുന്നത് answer is 12 months. The next question, congenital malformation in which urethral opening is on the dorsum of the penis. The options are hypospadiasis, epispadias, phimosis, and ectopia vesica. And the answer is epispadias. The next question, Apgar score consists of the following components except. The options are heart rate, respiration, temperature, and muscle tone. And the answer is temperature. The next question, the ratio of chest compression to ventilation ratio for newborn resuscitation is. The options are 3:1, 1:3, 3:2, and 2:1. And the answer is 3:1. The next question, which among the following factor is closely associated with the retinopathy of prematurity? The options are congenital anomalies, low birth weight, sepsis, and phototherapy. And the answer is low birth weight. The next question, congenital anomaly characterized by a ganglionic segment of bowel. The options are intestinal atresia, volvulus, Hirschsprung's disease, and intussusception. And the answer is Hirschsprung's disease. The next question, markedly retarded growth, psychomotor changes, and edema are essential features of. The options are kwashiorkor, marasmus, tetanus, and pellagra. Next answer is kwashiorkor. Next question, the following are components of oral rehydration solution except. The options are potassium chloride, sodium chloride, potassium citrate, and sodium citrate. And the answer is potassium citrate. The next question, an acute infectious disease caused by enterovirus. The options are poliomyelitis, diphtheria, typhoid fever, and mumps. And the answer is poliomyelitis. The next question, knuckle translucency in UST is strong marker of. The options are Down syndrome, IUGR, IUD, and fetal macrosomia. And the answer is Down syndrome. 11 to 14 weeksലാണ് ചെയ്യുന്നത് NT scan. The next question, serum HCG will not show characteristic rise in. The options are multiple pregnancy, molar pregnancy, ectopic pregnancy, and normal pregnancy. And the answer is ectopic pregnancy. The next question, which is the leading cause of MMR in India? The options are hemorrhage, sepsis, unsafe abortion, and eclampsia. MMR means maternal mortality rate. And the answer is hemorrhage. The next question, which of the following is a positive sign of pregnancy during first trimester? The options are Haga sign, UST evidence of embryo, Osiander sign, and Chadwick sign. And answer is USG, evidence of embryo. The next question, detection of which immunoglobulin by chondrosynthesis indicate intrauterine infection? The options are IgA, IgG, IgM and IgE. And the answer is IgM. The next question, which is shortest diameter of pelvic inlet? The options are epidiameter, transverse diameter, oblique diameter and sacrocotyloid diameter. And the answer is sacrocotyloid diameter. The next question, all of the following are hematological changes during pregnancy except the options are blood volume increase, total HB increase, hematocrit increase and plasma increase. And the answer is hematocrit increase. The next question, maternal component of placenta is developed from which layer? The options are decidua basalis, decidua parietalis, decidua capsularis and chorion frondosum. And the answer is decidua basalis. The next question, by which process glucose is transferred to the fetus? The options are simple diffusion, facilitated diffusion, pinocytosis and active transport. And the answer is facilitated diffusion. The next question, which is the most commonly used inhalation analgesia in labor? The options are Entonox, nitrous oxide, meptazinol and diamorphine. The answer is Entonox. The next question, the method and practice of teaching adult learners is termed as, options are andragogy, pedagogy, heutagogy and none of the above. And the answer is andragogy. And pedagogy means method and practice of teaching and heutagogy means self-determined learning. The next question, harmonious blend of diverse philosophies of education refers to? The options are eclecticism, naturalism, idealism and realism. And the answer is eclecticism. Next question, brief description of events or situations to which respondents are asked to react and provide information about how they would handle the situation described in research is, the options are Q sorts, vignettes, semantic differential scale, ecologic momentary assessment. And the answer is vignettes. The next question, a formal tentative statement of the expected relationship between two or more variables under a research study is, the options are research problem, research design, hypothesis and abstract. And the answer is hypothesis. The next question, the subject may have in a particular manner because they are aware of them being observed in research is dash effect. The options are Hawthorne effect, experimental, novelty and halo effect. Answer is Hawthorne effect. The next question, recruiting all people from an accessible population who meet the eligibility criteria over a specified time interval or for a specified sample size for research is a dash sampling. The options are cluster sampling, stratified, systematic and consecutive. And the answer is consecutive sampling. The next question, ethical principle that empower person to make free decisions can be implemented by, options are consent, matching, randomizing and confounding. And the answer is consent. Next question. The qualitative research approach is to trace out precisely the life experience of people is dash research. The options are grounded theory, ethnographic, phenomenological, and historical. And the answer is phenomenological. The next question. The extent to which an instrument consistently measures a concept in a research study is known as. The options are validity, reliability, triangulation, and lambda. And the answer is reliability. Next question. The purpose statement in research should identify the study variables and the options are design, data collection tool, statistical method, and population. And the answer is population. The next question. The process of choosing right candidates for right job in management process is known as. The options are selection, recruitment, induction, and promotion. And the answer is selection. The next question. The type of leadership style where the leader seeks opinions and suggestions from followers in management processes. The options are authoritarian, laissez-faire, bureaucratic, and democratic. And the answer is democratic. The next question. What is the nurse-patient ratio in ICU of a hospital as per Indian Nursing Council? Options are 1:5, 1:3, 1:1, and 1:10. And the answer is 1:1. This question കഴിഞ്ഞ DHS exam DME exam എല്ലാം ചോദിച്ചതാണ്. The next question. The force that prompts the individual to observe rules, regulations, standards, procedures necessary for an organization is. The options are authority, discipline, power, and delegation. And the answer is discipline. The next question. Barriers of communication arising from linguistic capacity of the sender and receiver is known as. The options are organizational, psychological, mechanical, and semantic. And the answer is semantic. Next question. In management process, the inventory that expires or loses its value over time and eventually becoming worthless is termed as. The options are perishable, non-perishable, furniture, and equipments. And the answer is perishable. The next question. The ethical principle of telling truth is known as. The options are fidelity, confidentiality, veracity, and justice. And the answer is veracity. The next question. Which among the following is a written defamation? The options are slander, assault, libel, and battery. And the answer is libel. Malays എന്ന് പറഞ്ഞാൽ publishing defamation and slander is verbalize wrong statement. The next question. The factual statement of duties and responsibilities of a specific job is known as. The options are job description, job specification, job evaluation, and job rotation. And the answer is job description. The next question. Collection, compilation, analysis, and distribution of data related to important events is termed as. The options are survey, surveillance, census, and vital statistics. And the answer is vital statistics. അപ്പോൾ ഇത്രയാണ് 100 questions വരുന്നത്. Thank you for watching.